I'm Angel Smothers, and I'm the Associate Dean for Community Engagement here at the WVU School of Nursing. I grew up in a coal camp community in Mercer County, and when I was growing up, there was really a major issue with access to care. We really struggled in connecting with providers, prescribers, or even getting vaccinations growing up. And so part of my experience is a lived experience. So faith community nursing is a subspecialty practice of nursing where the focus is on nurses working within and through faith community settings to support people within those settings, but also the surrounding communities. Across the state, especially in the most rural parts of the state, so the southern counties, Mingo, McDowell, Mercer, Wyoming, are some of the most isolated areas of our state, very rural. West Virginia is the third most rural state in the nation, but we're the only state that's located fully within the Appalachian region. So our culture is very much centered around the Appalachian culture. Well, in those counties where there's limited access to care, we have nurses who are building their programs that include screening, education, outreach, but also helping to facilitate telehealth support for people who need help connecting with providers outside of their area. The programs that the nurses build are not cookie cutter. They are very much based on the needs assessment that each individual nurse does in their community. And so depending on the community is the driving force behind the services that particular nurse will offer. And so some of the things that we've seen consistently and to be really the most successful include health fairs, where the faith community nurse organizes and facilitates almost a collection of resources coming together, and the community comes, interfaces with those folks, and learns about what's already there. And also screening as a part of that. Faith community nurses also do a lot of one-on-one sessions where people will come, they will have questions about their health, about their medications, and the nurse can direct them and guide them based on that information. So the course is open to any nurse who is interested in learning about the work that can be done within a faith community setting. But we also offer the course to non-nurses. So if pastors, social workers, or other interested individuals want to take the course, they can, to learn about this role of nursing within faith communities. The Foundations of Faith Community Nursing course is a national curriculum. And the curriculum is housed and updated through the National Spiritual Care Association and the Westberg Institute. And so it's an evidence-based curriculum, and that's what we offer here at the WVU School of Nursing. So the nurses that complete the training are consistent across the country for everyone who completes this training. And so the course here in West Virginia is an all-online course because we have nurses that live in isolated areas who can't travel. And so the course is an 8-week-long course that includes content that helps them to learn to get started, building their programs, and then also best practices for providing support and care for folks across the state. The course being all online still has a component where the nurses engage with each other. So we have an interactive discussion area where they get to know each other. And so beyond the course, these nurses have facilitated support for each other as a stakeholder network. And so we have found success not only in training them and equipping them, but also in the fact that they have amongst themselves built a network of support. Over the last decade here at the WVU School of Nursing, we have trained nurses across the state of West Virginia in 22 of our counties and growing. We have a cohort currently taking the course, and we actually offer the course 3 times a year. So we have nurses around the state who join in, take the course online, but we also have nurses from around the country who take the course. So we have a nice integration of both West Virginia nurses, but also an outsider view from other states and what they're doing. Funding for the work that we're doing really can come from multiple sources. We have support from foundations across the state of West Virginia who have been instrumental in providing us with financial support to get this program going, but also donors. So the donors, when they make these donations, we use these funds directly in those communities. And so we identify the nurses, we train them, we buy them all of the equipment that they would need to get started, and the course is free to them with scholarships made available by donors. And then we also provide them with a stipend, which helps to cover their gas or supplies that they may need to build and grow their programs. While the nurses do receive, some of the nurses that we train receive stipends, the majority of the work is on a volunteer basis. And so we're working diligently to identify sustainability sources, including insurance buy-in to reimburse these nurses or partnerships within their communities. But the volunteer piece of it really is driven by the fact that these nurses are insiders in those communities. They love the people, they know the people, and the people trust them. And so we're finding success in using that model versus sending someone from the outside in, which does not work in Appalachia. WVU is one of 2 land-grant institutions in the state of West Virginia. And so our focus is on engaging within the community. So looking for ways that we can build reciprocal support among and within communities across the state of West Virginia. And so our goal is to fulfill that land-grant mission here at the WVU School of Nursing by finding ways to creatively engage with people, meeting them where they are, and supporting them in ways that they are interested in receiving. And so we build up a network within their communities that can be sustainable as a part of our land-grant mission. It's really important for us to identify nurses from within those communities, train them, raise them up, support them, equip them, because there is an issue within the Appalachian culture of trust. It just so happens that nurses for the 23rd straight year are the #1 most trusted profession. So we've got a lot going for us in building nurse-led access to care points.